guys, welcome back to Psych with Psycho. If this is your first time here, my channel is basically a 101 on psychology, and I've been receiving numerous messages and comments about what I should discuss in this video, and the response has been overwhelming. I hope you guys are staying home, keeping safe and maintaining a social distance during these depressing circumstances. And with that being said, I felt it was apt for me to discuss the Beck Depression Inventory. Okay, so before we begin discussing and describing the Beck Depression Inventory, which I will now refer to as the BDI, I will give you a little insight on depression. Most people believe that depression is a mood or a phase of extreme sadness, which is not completely wrong, but nor is it completely correct. Rather, depression is a common mood disorder that affects an individual's function across different domains. Currently, more than 350 million people suffer from depression worldwide, and it significantly contributes to the global burden of disease. Depression stands out not only for its high prevalence, but also due to the probability of associated relapse and recurrence. According to the World Health Organization, depression is the most prevalent disorder among serious psychiatric disorders and is characterized by changes in sleep, appetite, decreased concentration and decision-making, loss of self-confidence, feelings of inferiority or worthlessness, and guilt. Dr. Bradley Gaines, a professor of psychiatry at the School of Medicine in North Carolina, says that the two core features of diagnosing depression are a depressive mood and anhedonia. Anhedonia means the loss of interest or pleasure in anything. He explains that people may be doing what they normally do, like exercising or listening to music, spending time with family, things that usually bring them a great deal of joy, and just can't get any joy or pleasure anymore. Depression is projected to become a globally prevalent disorder with a huge burden to the population. Among the available self-assessment instruments, the 21-item Beck Depression Inventory, commonly referred to as the BDI, is one of the most popular measures of depressive symptoms worldwide. This measure was first proposed by Dr. Aaron T. Beck in 1961 at the Center for Cognitive Therapy and has been used in more than 7,000 studies so far. The instrument is made up of a 21-question multiple-choice self-report inventory and is one of the most widely used psychometric tests for measuring the severity of depression. Its development marked a shift among mental health professionals who until then viewed depression from a psychodynamic perspective instead of it being rooted in an individual's own thoughts. What is the purpose of this instrument? Well, this instrument was solely created for the purpose of measuring symptoms of depression and their level of severity in people 13 years and above. Even though the BDI is not a diagnostic tool or instrument, it was created to aid clinicians in the assessment of psychotherapy for depression. Recently, the BDI has been ever increasingly used in the medically ill to evaluate depressive states that occur in high prevalence in healthcare settings. Next, we will discuss the different versions of the BDI. Since its development, 3 versions of the BDI were produced. As previously mentioned, the original BDI was first published in 1961. This was later revised in 1978 and was published again as the BDI 1A. The final revision was published in 1966 as the BDI 2. So why did it change? After the American Psychiatric Association published the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, the Beck Depression Inventory was revised to reflect the changes to the diagnostic criteria for major depressive disorder. What actually changed? Well, the updated BDI is similar to the original, except the timeframe taps psychological and somatic manifestations over a 2-week period, unlike the original, which was just 1 week. This was done to correspond with the DSM criteria for major depressive disorder, and in order for the BDI to stay current with some of the listed symptoms, self-dissatisfaction was changed and replaced to loss of pleasure, body image was changed and replaced to worthlessness, work difficulty became loss of energy, weight loss was dropped and difficulty concentrating was put in place of that, and lastly, somatic preoccupation was changed to tiredness or fatigue. How is the instrument different from the rest? The development of the BDI was an important event in psychiatry and psychology. It represented a shift in healthcare professionals' view of depression from a Freudian psychodynamic perspective to one guided by the patient's own thoughts or cognitions. It also established the principle that instead of attempting to develop a psychometric tool based on a possibly invalid theory, self-report questionnaires, when analyzed using techniques such as factor analysis, can suggest theoretical constructs. The instrument remains widely used in research and has been used in over 2,000 empirical studies. The method of administration. To administer this tool is pretty simple and requires a piece of paper and a pencil. The test can be conducted either as a group, individually, or orally. What scale does this measurement use? Well, the questionnaire lists 21 symptoms or behaviors that the client needs to focus on and evaluate how they were feeling for the past 2 weeks and the current day, by either circling a 0, 1, 2, or 3. The items are rated from a 0, not at all, to a 3, an extreme form of each symptom. How long will this test take? Self-administration is between 5 to 10 minutes, while oral administration is approximately 15 minutes. No questions are to be skipped, ensuring the validity of the test to be deemed true. The administration of the test is very straightforward and simple to take. If the test is being administered orally, the administrator will verbally ask the required questions. Example: 0. I do not feel sad. 1. I feel sad. 2. I am sad all the time and I can't snap out of it. 3. I am so sad and unhappy that I can't stand it. The client will obviously give their answer and the administrator will then add up all the points at the end of it. Now we move on to the score range and evaluating the scores. The BDI has a score of 0 to 63. Items are summed to create a total score, with higher scores indicating higher levels of depression. 0 to 9 denotes that it's a minimal form of depression. If the points ranges from 10 to 16, it suggests a mild form of depression. 17 to 29 points denotes a moderate form of depression, and 30 points on up to 63 points denotes an extreme form of depression. What are the strengths of the BDI? It's time efficient, very user friendly, easy to administer and score. It's based on psychometric properties. It has a predictive ability. It has been translated into languages other than English, and its psychometric properties have been established in numerous cultural groups, including the deaf population. More so, the symptoms and time frame correspond to the DSM criteria, and it can be administered orally by an examiner to those with reading difficulties or problems with concentration. What are the limitations of the BDI? The BDI undergoes the same problems with other self-report inventories, such as scores can be easily exaggerated or minimized by the person completing them. Like all questionnaires, the way the instrument is administered can have an effect on the final score. In participants with physical illnesses, the BDI's reliance on physical symptoms such as fatigue may artificially inflate scores due to symptoms of the illness rather than symptoms of depression itself. Therefore, there is no evidence that the BDI is more valid or reliable than other depression scales. Although the measure can be used for adolescents, the norms were gathered with adults. How valid is the BDI? Well, it is worth noting that the BDI is not only extensively applied for research purposes, but also in clinical practice. Since its publication, numerous studies provide evidence for its reliability and validity across different populations and cultural groups. Results have consistently shown good internal consistency and test-retest reliability. Criterion-based validity have also found the BDI to be sensitive to change with treatment, including randomized trials with individuals who have experienced a trauma and those diagnosed PTSD, thereby supporting its clinical utility as an indicator of the severity of depression, but not as a diagnostic tool. The instrument tested negative for biasness against ethnicities or minor populations, as well as gender biasness. Generally, the BDI is a well-studied instrument and has been extensively tested. Before we conclude, I think it's imperative to note that Dr. Beck always emphasized the fact that behavior and emotions are dictated through perception, so that if a client had any damaged schemas or a negative outlook on life, or self-hatred, a negative outlook on their future or the world around them, it was critical to go ahead and see that these people were treated for depression. And I think that sums up what the BDI represents. Remember, you can't diagnose someone by only utilizing the BDI. It is only a tool for measuring the severity of symptoms. The BDI assists diagnosis, but it does not replace it. Before I go, don't forget to give this a thumbs up, drop a comment, and hit the subscribe button. Until next time, stay home so we can leave home. Bye.